Kei ngā manukura o te motu rarau mai ki te hui. Ko mihi ngā rangi tēnei e mihi atu nei kia koutou katoa. Welcome to the Hui, Maori current affairs for all New Zealanders. E taro ake nei. Locked down, isolated and suicidal.
I just remember waking up every day and thinking, bro, I hate being here. Why do I keep waking up?
We look at one rangatahi's mental health struggle in lockdown.
My concern is that there will be a hidden pandemic of mental health issues, especially amongst Maori and Pacifica, and especially amongst the younger group.
Then we discuss the challenges Whanau face dealing with Delta in self-isolation.
There is no more than one bathroom in the house. There is at least 6 to 8 whānau in the house. They can't isolate separately.
And we speak to Maori politicians about COVID-19 and what lies ahead in 2022. Tahuti mai. For some, the Delta lockdown has had a devastating impact on their mental health. Early this month, the government announced a $5.6 million funding increase for mental health services in Tāmaki Makaurau. And for some, it can't come soon enough. D'Angelo Martin spoke to a young man who struggled to access mental health support following a suicide attempt. And a warning, this story discusses suicidal thoughts and themes some viewers will find distressing.
You can't tell by looking at him, but behind Arapuni tāne te awamana smile lies an immense amount of mamai. Arapuni is just like many others here in Tāmaki who are just trying to get by. When lockdown hit, he found himself battling with his mental health.
I had some mean suicidal thoughts. When lockdown started, I just remember waking up every day and thinking, bro, I hate being here. Why do I keep waking up? Why am I not? I didn't want to wake up the next day.
Arapuni has been living in alert level restrictions for 3 months. He lives by himself and says being isolated and far from whānau really got to him.
I had all that time throughout the day to myself, just stuck in thought, And yeah, there's just heaps of things, Whānau's key, especially to me. That's something I hold close to me, and that was just not there.
Have you ever experienced depression before this come about, or?
Yep. I've battled with mental health my whole life. I've got PTSD, and I've got lots of anxiety. I have anxiety attacks. But this one was probably the worst. I battled with depression. I got diagnosed with depression.
By September, Arapuni was at breaking point and reached out for help.
It was about 8 at night. I called because I knew in myself that was it. I couldn't handle it, bro. I couldn't do it anymore, and then I was on hold periodically with them for about 45 minutes. No answer, I hung up. I was like, bro, this is too long. Call back, 45 minutes on hold, too long. I hung up. I called back once and I was on hold for about 15 minutes, and I was like, stuff this, bro. I'm not going to call back. I'm going to take matters into my own hands. I'm going to end this. I don't want it anymore.
His suicide attempt saw Arapuni admitted to Miramore Hospital, where he spent a week in a coma.
I remember them saying, you've been in a coma for a week or over a week and a bit, and we had you on ventilators, you had 15 different medications going into your body. And I was like, nah, it's Father's Day. It's still Sunday. What do you mean? It's not, I haven't been asleep that long like you have, and you nearly lost your life. There was 4 times where the doctors thought that I was going to lose my life.
While in hospital, Arapuni says the staff went over and beyond aiding him while in a coma.
They did a journal for me of all my notes. They were writing notes for me, and I remember they were writing notes on behalf of my mum as well, and my dad. And yeah, I read it, bro, and it hit me, bro. It hit me heaps. Reading all those words from people. I didn't know that people were there.
Arapuni was then released to a mental health unit for 5 days, but has struggled to find support.
I got told, you're going to have a support team from the mental health in South, and they'll follow up with you and make a plan. And I never ever heard from them.
To make matters worse, when Arapuni wanted to return to where he was staying in South Auckland, he was forced to find other accommodation.
At the start of lockdown, I worked one day off-site, and because it's a communal building as well, they were like, oh, you can't come back. Because of the restrictions of COVID, I wasn't allowed to return back to the building until level 2.
He now resides at Barclay Suites in central Auckland, but he says accessing mental health support has been almost impossible.
Then I got a call and they said, because you're on Central and our team's based in South, you're out of our boundary line, we'll refer you to Central. So I waited about another week and a bit, and I got a call from the and for the Central team, and they just said, oh, because where you're staying temporarily, we don't want to do anything because you could move, say, back to South and then we'll have to transfer and they'll have to start all over again.
The issue for us as a society is that we're told, the promotion is seek help. And when you go to help, this is what you get.
Maori mental health expert Dr. Maria Baker.
Yeah, to be honest, he will be one of many who will be struggling. My concern is that as a young Māori man, having had early contact with mental health services, that he's going to fall through the gaps, and he is asking for help. He needs the sort of help that's going to walk beside him, not put him in a mental health unit.
Statistics show a decrease in suspected suicides over the last year, but Baker says they may not tell the full story.
My concern is that there will be a hidden pandemic of mental health issues, especially amongst Māori and Pacifica, and especially amongst the younger group, those at kura and schools, and those in younger adult years who are just getting into their careers, just getting into relationships and having families, and this stuff is, upon them.
And why do you think it's important that you're sharing your story?
Because I've just seen similar stories too much now, especially in today's day and age, especially throughout lockdown. I lost so many friends, and you just see the lack of help out there for people.
How are you feeling now?
Well, what I've been doing to keep my mental health in check is I've been walking. I walk out Mission Bay, Orake. I've definitely felt lost. I've felt the same feelings prior to going into hospital. Something that helps me is always swimming. I love going swimming at the beach. Reaching out for help for mental health is obviously not an option for me in my situation about where I stay, so it's all up to me to keep myself in check, I guess.
Kia kaha Arapuni, and the hui strongly encourages anyone in crisis to reach out to the mental health service in their rohe. You'll find more information on our Facebook page. After the break, we discuss the challenges whānau face self-isolating. With Maori now more than 42% of COVID infections, many COVID-positive whanau are now having to self-isolate at home. And that's creating greater stress for whanau who are already under pressure. Our reporter Rewa Harriman spoke to Awerangi Tamihere from Te Whanau or Waipareira, who have been supporting self-isolating whanau in Tāmaki ki te uru.
Can you tell us what it's like for whanau Māori isolating at home? What are the challenges?
Well, I think probably the main challenge for all of them is that prior to being positive, prior to being in this COVID pandemic, they never had a lot of headspace in the first place to be able to look out past the hour, the day, the week. And not only that, if they didn't have that headspace, they also didn't have the space to even stock up for 3 months, right? And as a result of that, you're dealing with a lot of the issues of poverty being absolutely exacerbated when they find out that they're positive and having to isolate at home, because how do they get food?
So how does your team help these whanau out then?
So the immediate thing our team do is go and get food for them. The other thing is that they get a lot of advice from the Ministry of Health about how they should isolate at home, but that's just not the reality. There is no more than one bathroom in the house. There is at least 6 to 8 whanau in the house. They can't isolate separately. The reality is they're having to live together. And so that also comes with, they can't go out in the usual way, go for a run, go and do something on their own. So the intensity of living together also brings about a lot of mental health challenges. So we're also having to bring in our kaimahi into their homes, sitting outside their homes, just talking to them, working through, just helping them to manage their relationships in a tight space. But also the reality is if you have one positive at home, it is highly, highly likely that other whanau in that situation will also be positive because they cannot isolate.
So numbers-wise, Awerangi, how many whanau is your team assisting?
Well, today, for example, we talk about in a different way. We've got about 75 whanau, but that's about 250 individuals because you're talking about one whanau that is positive or one member, but it goes within the whole household. And that's an intensive amount of resources. We don't know the whanau who are positive unless they ring us up. So a lot of them are ringing us up on our 0800 number because they're not sure what to do. And so we're having to set up now a mobile nursing team who go in, who provide some initial support, testing, advice, bring in the GP, bring in the public health team, set them up from a medical point of view. And then we bring in our welfare support team who have the ongoing relationship with them.
Is it a better option then to send these COVID positive whanau to MIQ? Is that the better option?
It's a different assessment for every whanau because their needs are different, but broadly speaking, yes, because at least you know they've got food every day, they can isolate properly with their whanau, and they can have a regular testing regime and a regular medical support wrapped around them intensively 24 hours.
How important is it for Māori organisations such as Waipareira to be leading this type of response?
Even though this is a very difficult time, when you're dealing with our own communities, you need to have trust, faith, and hope. And when our own people can come on the door, just the look in the eyes is emotional, crying, just, oh gosh, somebody who understands me comes in. There's somebody finally there who just says, this is us, this is where we're at. Can you wrap around us to meet everything we need in our household, rather than having to navigate to different agencies?
With some of your team redeployed now, how does that impact on your vaccination program and your testing?
Yes, because we had to suddenly pivot and go from 4 mobile vaccination teams, for example, to 2 vaccination teams. And then we had to move some of our nurses and other teams to provide the support for positive whanau at home. So it means it reduces our capacity to do vaccinations. We're good at being agile and good at moving when we need, but it's not one or the other, is it? It's vaccinations. Testing is huge for us. Our numbers are getting up to 700 to 1,000 a day at the moment again, because there are so many positive whanau in West Auckland. So we're actually having to ask for extra support again from the DHB to help with nursing support. So for Waipareira, it's not one response or another. It's about trying to keep all 3 going. It's pretty tough on our staff at the moment.
And finally, do you have a message for our whanau isolating at home?
Please ring us. Please ring us, 0800 942 924. We are open 8 a.m. to 8 p.m. and do not sit there and wait and hope. We will get somebody to you within the hour on the phone talking to you. So just please do not be afraid to give us a ring. We also have our Facebook page, our Instagram page, where we get a lot of private messaging. You can private message us, but we are here for you. So please don't be afraid to give us a call. We'll be there right away with whatever you need.
Ko awirangi tamihiri tērā. Next, we discuss the political response to COVID with Willie Jackson, Marama Davidson and Deb Ngāriwapeka. It's been a gruelling year in Te Ao Tōrangapū as Māori politicians grapple with how best to serve Māori as COVID menaces communities across Aotearoa. I spoke to the Minister for Māori Development, Willie Jackson, Greens co-leader Marama Davidson and Te Pāti Māori co-leader Deb Ngāriwapeka about their party's COVID responses. Tēnā koutou, thank you so much for joining us this morning. We're very lucky to have the three of you. Let's start with you. Māori are now 42% of all cases, 31% of hospitalisations. Has this been preventable?
Yes, it could have been. We're pleased that our government chose the elimination strategy. It's when we started to veer away from the elimination strategy that the Greens made our difference very clear, and that depended on making sure we get the pūtea and the data directly to our Māori health providers to lead and design the work to get our vaccination rates up higher. That's why the Greens want to make sure that before we lift our Auckland border restrictions, we see vaccination rates equitably high. We see our regional public health systems properly prepared, for example, with ICU capacity. And we actually test and refine the traffic light system instead of putting a date already in the sand to lift the borders before we've committed to seeing what needs to be improved with the traffic light system.
So under 9s are now the second largest group at 18% of all infections. The COVID strategy was meant to protect our most vulnerable, including our tamariki. You know, in your eyes, has that happened?
No, it hasn't happened. And I think, first of all, we've got to acknowledge that this government has inherited a hell of a job. And I think, You know, they did extremely well in 2020 when the focus, as Marama said, was on elimination. What we're now seeing, unfortunately, is the escalation of the inequities we went into with this, and unfortunately the disconnect that the Crown has allowed to happen by having a one-stop shop approach. It never works when you're dealing with real living communities of Māori on the grounds. You know, it's great to see the investment that's starting to happen now that we're at the bottom of the cliff and you know, the tragedies are happening. But what we want to see now is that it's not just a monocultural approach, that actually we have a very loud, proud Māori COVID response, and we own that as a nation that's proud to have te tiriti and tangata whenua.
Prior to taking us out of level 4 into level 3, we were around 20 cases a day. We're now up at 200. You know, was it wrong to lift us to loosen the restrictions?
No, it wasn't, and the reality was, I represent a lot of Maori here in Auckland, as does Marama, and people in Papakura, people in Manurewa, people in Mangere, Ngāti Whātua were all saying they don't want to be in level 4. They don't want to be in level 4. So it's okay for people outside the Auckland area to say, you know, we'll lock you up and we'll keep you in level 4. You say that to 10 Māori living in a 2 or 3 room place next to my marae ngā whare wātia.
Isn't lockdown protecting them?
Well, lockdown is, but it's not for us to patronise our people. It's not for us to say, my crew at ngā whare wātia, and I still cheer the marae there, they go out, they go to their houses. Sadly, our people are breaking the rules everywhere. So we just have to assist and support. But the reality is our people need jobs too. And while it might be ideal for the Māori Party and the Māori doctors and the Māori academics to lock our people up for the next couple of years, that's not a reality in terms of Auckland, and our people need the freedom to move.
Is this strategy working for Māori?
This is precisely why we needed to make sure we are taking a cautious approach, is because of those very inequities. You know, I was taken around Randwick Park, which is Manurewa, and showing the rip-off rents that our people are being charged, the bad quality housing that they're living in. It is exactly because of those long-standing inequities that we needed the leadership to be able to say, hold on, tai hoake for a little bit longer while, hey mihi, we can see vaccination rates for Māori are increasing. What that shows is when you finally do get the resource there, we can do it. Māori independent and non-Māori epidemiologists and COVID experts have been very clear, just a little bit longer while we urgently prioritise fixing regional public health, fixing vaccination rates, testing the traffic light system properly.
You know, the Māori Party strategy around self-isolation is to have it all Māori-led. So all of your strategy really is about Māori iwi and organisations to lead everything. But not every iwi and not every Māori organisation is the same. You can't compare, they're not apples with apples because they're not all up. So, you know, in those rohi or those takiwā where they don't have leadership, how would you do it?
Ultimately, how we would do it is how we've done it to date. Most of our policy has been marked off and plotted off how we're living. So if we've got a situation where, for example, we've got home isolation, what we want to do is, and we don't have MIQ space, we want to be able to have the wraparound support so that compliance does happen. A lot of the reason why our whānau are breaching is because there isn't that tautoko, that encouragement to stay home. The $100 our policy is to actually encourage that you stay home and to be able to connect to those. Again, now, what we've seen on the ground is that somebody gets infected, no one tells the community how to go and give kai. Perfect examples of what Huni is doing up in Taitokiro is that let's not shame, let's not make this you're ostracized from community. Let's, as a community, look after everyone and keep sight of that. There's an assumption that communities aren't self-managing now, and we are and have been. And that's I think that's the real danger and the opportunity being missed, is the full engagement of communities and not someone sitting behind a desktop or someone from Wellington sort of decreeing this is how it will be, taking a very iron fist approach. To get buy-in, you have to bring the community with you, ground up.
Willie, did you guys do it too late? Did you move to hand over to Māori organisations too late in the game?
No, I don't think so. We've worked very closely with Māori organisations.
From the beginning?
From the beginning?
Right from the beginning, and you can ask some of them if we hear the different narratives. Look, this is a moving feast. That's the reality. I think we all realise that we're a government for everyone. We are not the Maori Party government, but we understand our people's priorities. So no, we've worked with them closely, and you have to remember we didn't have Delta back in March and April. We didn't have vaccine back in March and April. So I think we paced this out the right way. Of course, we're absolutely concerned where we're at now, and Deb's right too. I absolutely will always advocate in terms of our community advancing this kaupapa. That's why you're seeing the resourcing and funding going in right now. So it's very much a by Māori, for Māori approach. And I'm just as concerned as everyone in terms of the self-isolation. That's why I'm working at the coalface with my marae, with Waipareira, and I think things are picking up. I think the vaccination rates, we're still 20% behind, but, we're vaccinating at 2-3 times the rate of Pākehā at the moment.
Last week, mandates kicked in health and education. Are you supportive of the mandates?
It's a case-by-case basis is what we understand. And so for our health workers and, yes, for our schools, those people at the front lines with our tamariki, with our kaumātua pakeke, with our people with health issues, absolutely it's about the safety of our whānau. I would have preferred, Mihi, if we didn't need those mandates in the first place for those high-risk environments, absolutely. But how long does it take to combat the mistrust from colonisation among our communities when we haven't prioritised that? Unfortunately, we haven't done that work yet. We've got a lot of catch-up to play before our people trust our public health system, which we all agree has been systemically racist.
Deb, you don't agree. The Māori Party wants to abolish all mandates.
We want to abolish the way that Labor has rolled out mandates. I think, again, we can't emphasise enough that our policy promotes an and approach. What we've got here is standoffs. And we've got to remember why we arrived at mandates with Labor. It was because they'd failed so dismally in the vaccination rollout. So let's just remind ourselves why we're here. This isn't something that Māori or communities have done wrong. And what we've got now is an approach that is going to end up, again, looking at a people that could have actually taken the control of situations themselves.
A message like this from the Māori Party, is that helpful?
No, not at all. In fact, they need to show more responsibility, actually. They need to realise that there are different messages in terms of the iwi. There's different messages in Deb's community that are needed to people in my community in Māngere. They are so different. You see, the Māori Party talk like we're all one homogenous group. We're not. 70% of our people, they don't want to know about the marae. They don't want to know about the Māori Party. Heck, they don't even want to know about Māori and Labour, right? So you're dealing with a disenfranchised group. So Deb talks like we're all on the kaupapa. We're all going to do this. That's just so far from the truth, it's not funny. And she needs to realise that we need a couple of strategies. We need this strategy that Deb talks about for our kaupapa people, absolutely. Then we need the other strategy. The mandates work.
We're an extremely dynamic, innovative people, and we are winning this, but we shouldn't have to have been in this position. So, let's not pretend that it's all flowers. You're in a mainstream party that has lotted us with everyone else at the end of the line.
Deb, if you had a bouquet or a mihi to throw out to a group or a person for their enormous effort in 2021, who would that be?
Oh, look, the enormous effort would go out to all our hauora, whanau providers. They have not had a break. This isn't an event. They've gone day in and day out, and I just want to mihi to them all and actually mihi to their whānau.
The team at Mate Huruhuru, which is a South Auckland, completely rangatahi-led program, they designed their own rangatahi vaccination events, jab and grab. They got their third one coming up with the support of Manurewa Marae, Ngāti Whātua, Waipareira, all of the tāmaki wraparound tuakana organisations. This is exactly how Māori work, and allowing and supporting our rangatahi to lead all around the country, I think deserves a piki mihi as well.
I want to especially mention iwi radio. They're sort of unsung heroes in terms of te ao Māori mihi. A lot of them are not well known across mainstream, but brilliant work at the coalface, you know, whether it's Peter Lucas in the north or my cousin Barbie Edana Reedy on the east coast, fantastic, Martai Smith. These are unsung heroes. And what I like about them is they're running the twin strategy. They know a lot of our people. Kare mohi o rātou ki te kōrero Māori. Don't speak Māori, but you know, it's really terrific what they're doing. And of course, my crew at Wātea, they're unsung heroes and they keep it going. So it's mihi to all of them for their wonderful contribution over the last 12 months.
Tēnā koutou.
Kia ora.
Kia ora mihi, kia ora Willie and Debbie.
Ko hikina te hui e hoa mā, no horo mai rā.